Hi everyone, I'm Madeline, and for my video, I am choosing to talk about an organization called Partners in Health. Partners in Health is an NGO that focuses on improving healthcare in developing countries. Their stated mission, directly from their website, is to achieve two overarching goals: to bring the benefits of modern medical science to those most in need, and to serve as an antidote to despair. It was founded by Ophelia Dahl and Paul Farmer, and these two have really been instrumental in the field of global health and human rights in advocating for the right to health for the poor. Um, Partners in Health began their work in Haiti, and they now work in 9 other countries as well. So I partly chose Partners in Health for this video because they've been really instrumental in advocating for health as a human right and improving healthcare in many of the countries that need it the most. So the basic idea guiding Partner in Health's work is that health is a fundamental human right and that no one should be at a greater risk for poor health outcomes because of where they live or under what circumstances they were born. So they really work to improve health not just out of charity, but upon the belief that everyone is entitled to these services in the science that's available today. So Partners in Health works by establishing long-term relationships with other organizations that are based out of the countries that they're working in, along with the local governments to help increase healthcare capacity and build healthcare systems. They implement a variety of programs over a wide range of health-related issues. These include programs that focus on non-communicable diseases, tuberculosis, maternal and child health, Ebola, gender equity, HIV and AIDS, mental health, and there's several others as well. Some of Partners in Health's accomplishments include conducting 1.6 million outpatient visits in clinics across the world, 1 million women's health checkups, 800,000 home visits by community health workers. In addition to these, they're really working to help build the next generation of doctors and nurses in countries that need them the most, and these are usually homegrown local people that are working to serve the areas in which they live. They've also played an important role in aiding and facilitating health reform in developing countries, and they're helping to research and pioneer treatments for major global health problems such as MDR and XDR-TB. So I think that Partners in Health has many strengths, and I think most of them lie in the structure of the organization. So the way Partners in Health works is they train community health workers and nurses in resource-limited places, which reduces their reliance on outside assistance for healthcare. And this is huge because it not only somewhat frees the people in these areas from reliance on outsiders, but places the role of delivering care and running programs in the hands of people from these areas who know the culture and the context and the needs of the area better than outsiders coming in trying to serve the people. They also work with local governments and organizations to improve infrastructure and healthcare systems, which lends itself to creating lasting change in health in those areas and really addressing the root causes of health inequality and poor health in these areas rather than just trying to put a Band-Aid over the issue. They also take part in research partnerships, which find ways to improve healthcare delivery in developing countries. And this is very important because most healthcare research is conducted in wealthy, developed countries. So conducting research in developing countries is important to finding the best way to deliver culturally and contextually appropriate care, since existing research doesn't always demonstrate that. So to wrap things up, I just wanted to talk a little bit more about why I chose this organization. I chose Partners in Health because they lead the field in global health work and advocating for health as a human right, both of which are interests and passions of mine. And I think Partners in Health is a really important organization in this field because many organizations have the stated intent of helping but can actually cause more harm or further dependence on outside help. And as I discussed earlier, the way that Partners in Health is structured demonstrates their commitment to creating sustainable, lasting change and improvement in health around the world. And they're trying to further research and how to do this better, and are responsive when we learn new things about how to do this better in different places. So overall, I would love to work for an organization like Partners in Health someday, and that's mostly why I chose to talk about this organization. Thank you for watching.